Today we will be discussing the role of occupational therapy and some one-handed lower extremity dressing techniques which could be used for an individual that has had a stroke or a CVA. As you will notice, the individual on the left is representing someone who has greater strength and range of motion, while the individual on the right is representing someone with decreased range of motion and will be following energy conservation techniques. Be sure the client always dresses the affected side first. To do so, cross the affected lower extremity over the unaffected lower extremity to aid in support and allow the client to use only one hand. The left individual is crossing at the knee, which makes it easier to put on the clothing, where the individual on the right does not have the range of motion, so they must cross at the ankle. Both individuals are using the wall for support, but the client on the right is conserving energy by staying seated and weight shifting in order to put on garments. The individual in the left video is able to stand to put on their clothing, but this technique should be used with caution as the risk for falling increases. Underwear, shorts, and pants can all be put on similarly. However, the client may find it easier to feed the pant leg onto their unaffected upper extremity before placing their affected lower extremity into the pant hole. If the client chooses to wear a garment with a button, the button hook is a great low-tech device to use. Here, you can see the client inserts the device through the hole and then hooks the button between the wire. This allows the client to pull the button through the hole with ease. Next, the client puts on a belt. In order to avoid slipping from the belt loops or falling to the ground, the belt buckle should be tucked into the waistband. The client now has their unaffected upper extremity available to feed the belt through the loops.
Now you will see two variations of how to put on socks and shoes. The individual on the left uses their fingers to spread the sock apart in order to place it over their foot. The individual on the right uses a device called the sock aid, which allows them to put on their socks with less range of motion and decreased intrinsic hand muscle strength. You can see the individual moves their unaffected lower extremity towards their affected lower extremity in order to hold the sock aid in place. The handles of the sock aid should be pointed down, and the bottom of your sock should be oriented over the cloth portion of the sock aid. The individual then places the sock aid on the ground in front of their foot. Pull the handles in an upward direction to slip the sock over the foot until the sock aid is removed completely. A device called the shoe horn can be helpful for putting shoes on the affected lower extremity. The shoe horn is placed in the shoe prior to the foot due to the individual's inability to hold the affected lower extremity in place while donning a shoe. This allows the individual to align and slide their foot down the shoe horn with one hand. Here you will see undressing of the lower extremity. It is important to note that the unaffected side should be undressed first. The wall is still used by both individuals for support. It may be easier for the client to doff both pants and underwear at the same time to reduce the amount of time and energy it takes to remove them separately.